Hello, Yorktown. It's Supervisor Matt Slater. We are here with a COVID-19 update. I'm joined with local resident and local practitioner, Dr. Gina Tartaglia. Dr. Tartaglia, thank you so much for joining us today. Appreciate it. We are far enough apart where we're going to lose the masks for a little bit so everyone can hear us better. Wanted to provide a couple updates on COVID-19. We're going to start with the numbers. We are still tracking the COVID-19 numbers here in the town of Yorktown. As of yesterday's report, which we received from Westchester County's Department of Health, we have 179 active cases within our community, and we had 39 new confirmed cases, and that was over the weekend. So we are still having COVID in our community, obviously, which is important for us to continue to take the preventative measures that we know work, which include wearing masks, social distancing, washing your hands, and of course, if you're not feeling well, to stay home and contact your doctor. And we're, again, thrilled to be joined with a local practitioner here from Yorktown. I do want to just talk about the vaccine efforts here within our community because they've been tremendous. To date, in the last month, we've been able to help provide nearly 2,500 vaccines right here in the town of Yorktown, and that's been a tremendous partnership with Westchester County, with our local businesses and local doctors like Dr. Tartaglia, and I know we're going to get into what you've been able to provide through your office. We are updating how we schedule people. I want to remind everyone that you can go on to yorktownny.org. Right on the home page, you can sign up to be added to our standby list. Our standby list will then receive an email notification once we have confirmation of a day and time for our next pop-up clinic. Our next pop-up clinic is going to be tomorrow, thanks to our friends at Save More Pharmacy. That would be the Cow family, longtime Yorktown residents. And so we'll be over at Jefferson Village tomorrow, which is Wednesday. And we'll be providing second shots for those who previously received the Moderna shot 28 days ago. And then there will be Johnson & Johnson shots available in the afternoon. But again, in order to make your reservation, you'll have to be on our standby list. You'll receive an email notification. So if you are on that standby list, please monitor your email and you can get the link and sign up for a slot. We are also partnering with Taconic Pharmacy right up in Jefferson Valley. We are awaiting to hear what day we're going to be able to provide our next pop-up clinic with Taconic Pharmacy, and we thank them for their partnership. And, of course, we have Dr. Tartaglia here as well. Now, Doc, you have an allotment over in your office that you're able to provide to the public?
Correct. Currently, we have just a handful of Moderna left, probably about 20 vaccines, and we just received 200 J&J, which will be starting to give out on Thursday.
On Thursday. And so if so this is separate from the town's efforts, but if people want to contact your office to make an appointment, how do they go about doing that?
So you just call my office number, 914-245-4186. The young ladies that answer the phone will tell you when you show up to the office, just like when you go to a pop-up clinic, you need an ID, you need your insurance card. There's some paperwork that we will provide if people want to wait until they come to the office and fill it out, or they can pull it off the New York State website. And then we will bring everybody in. They'll be assigned an appointment. They come in, and they're in and out probably within 20, 30 minutes.
Excellent. And your office is located where?
So our office is right next to Solaris, across the street from the Jack DeVito Field, 225 Veterans Road.
Right here in the Heights Hamlet.
Yes.
That's perfect. So for those, again, who are looking for a vaccine, and I do want to acknowledge that there are many appointments available through the state clinics, which is great, down at the county center. But if you're looking for local options, they are here in the town of Yorktown, which is great. And we really appreciate your partnership and help.
Thank you.
As well as the partnership and assistance by Save More Pharmacy and Taconic Pharmacy. But I do want to just get into a couple of other things real quick. I want to start with the updated travel advisories that was issued by the state of New York. The travel guidelines require all New Yorkers, as well as those visiting from out of state or another country, to take personal responsibility for compliance in the best interests of public health and safety. This is pulled right off of the state's website, so if you are planning on traveling, very, very important that you do your homework, you do your research. It is spring break at that time of year. It was spring break last week. I know people were traveling. Very important, though, before you travel to check the requirements of where you're going and also know the state requirements upon your return. It's important to note that asymptomatic travelers entering New York from another United States state or territory are no longer required to test or quarantine as of April 1st, 2021. So that's a big change from where we were. So I want to say it again. If you are traveling from another state, coming back home to Yorktown, you no longer need to test or quarantine, which is great. The other thing I want to just talk about quickly, and we had Jim Mazzano, who's the director of Consumer Protection Affairs for the Westchester County. We had Mr. Mazzano on a few weeks back, and we talked about vaccine scams. But the fact of the matter is vaccine scams are growing still, and so it's really important to remember a couple of items. First off, all vaccines have been paid for by the federal government and are free to everyone. So you must administer the COVID-19 vaccine at no out-of-pocket cost to the recipient. So you should not be paying for your vaccine. That's very important. No one can deny vaccination based on the recipient's coverage or network status. You may not charge an office visit or other fee if administration of the COVID-19 vaccine is a sole medical service provided. You may not require that other medical services be provided before providing the COVID-19 vaccine, and may not seek any reimbursement, including through the balance billing from vaccine recipients. Bottom line is, if you want the vaccine, you do not need to pay for it. And that's the important thing that we want to make sure that our residents understand. And also, no one's going to proactively call you and tell you to come get your vaccine and charge you for it. That's also something that we want to make sure, especially our seniors, understand. So someone you don't know is on the phone telling you it's time to get your vaccine and it's going to cost you a few bucks. That is a scam. Hang up immediately. If you can, take down the phone number, and you can always refer it to the Yorktown Police Department as well, and you can always reach them at 962-4141. And, of course, we thank our law enforcement officials for their great work. But, Doc, I want to ask you a couple of questions, if you don't mind, while we have you. So, again, you're providing the vaccine to our residents, which is great. What is the age limit right now that you're able to serve?
Okay, so right now, based on the vaccine guidelines and the CDC guidelines, Moderna and Pfizer, which were made the same way, as long as the person is 16 years old or above, we can administer the vaccine. Obviously, if they're 16, they should have a parental consent. Mm-hmm. If the J&J, which we'll be giving out in a few days, right now I expect them to lower it to age of 16, but currently it's 18 and above.
Okay. That's you're waiting for the state guidance.
Correct.
On that to drop it to 16.
Correct.
Perfect. That's great. I hear a lot about apprehension. There's still a lot of apprehension out there about receiving these shots. What do you have to say to that?
So people have different reasons for being apprehensive, and most of it is what they hear on the news. A lot of people are afraid that it's not going to last long enough. And honestly, we don't know how long it's going to last. But based on what I've seen over the last year, people do develop antibodies. There are some antibodies we can test for, others that we can't. But I expect it to last at least a year. Mm-hmm. So we will probably, like the flu shot, need a booster in about a year. I don't think COVID's going away anytime soon. Other concerns people have is side effects.
Right.
They're worried about how bad is it going to be. In general, everybody should expect some side effects: soreness at the site of the injection, redness, itchiness, sometimes a headache, body aches, like you have a cold, a little runny nose. I tell everybody after they get the vaccine, take Tylenol today, take it tonight, Advil, Tylenol, whatever works for you, take it over the next 24 hours and you should be fine. Within one full day, everybody should be fine.
Great. And what precautions, is one of the things I've heard is people are concerned about a reaction to receiving one of these shots, whether it's Moderna, Pfizer, or J&J. So when they come into your office, what precautions are you taking so that if someone does have a reaction, that it's obviously handled appropriately?
Right. So we ask everybody about allergies, but honestly, out of the 400 or 500 we've given out so far, have not seen one reaction whatsoever. No issues with blood pressure, headache, no issues with allergies, no issues with shortness of breath, chest pain, nothing at all. However, that being said, we are totally set up, as the pop-ups I'm sure are, with EpiPens in case there's an allergic reaction. We have oxygen in the office. We have an AED in case somebody has some event that is probably unrelated to the vaccine, but completely prepared.
Awesome. I know that based off of the roughly 2,500, 2,000 that have been provided through the town at our pop-ups, I think we had one incident, and it was more so about a person who it was a shot, and so people don't like shots.
Right.
And so it had nothing to do with the vaccine itself.
Yes.
But to your point, again, we haven't seen any reactions or had any, knock on wood, any medical emergencies that were based on a reaction to the shot. In regards to underlying health conditions, what should people who have underlying, what do you tell those people? And we've talked about diabetes, we talked about MS, we've talked about cancer patients, and even women who are pregnant.
Correct.
What do you say to them about the shot, and if you recommend them getting that shot?
So what you have to do is you have to weigh the risk and benefit. Is it better that I allow myself potentially to get COVID, or is it better that I get the vaccine and get protection? In people that are obese, have other underlying comorbidities like diabetes, hypertension, even pregnancy is considered a comorbidity. It is without a doubt much better to get the vaccine than it is to wait and hope that you don't get COVID.
Right. And of the cases that we've seen over the last year, are there certain comorbidities that we feel are more susceptible?
In general, people that are obese tends to always come to the top. Number one, when you ask people or you count and you look at people, it's obesity. Diabetes is always a problem. Hypertension, I can't say is always an issue, but typically people that have hypertension tend to have diabetes. They tend to have some heart disease.
Yeah.
So if you have any of those things, absolutely you should get the shot. You shouldn't think twice about it.
Perfect. And that's great to hear, especially coming from a medical expert right here in our community. And I know that one of the things I want to talk to you also about is the importance of a local option. Because I know that you were telling me a story about your daughter and how you were trying to get your family vaccinated.
Correct.
And you had to travel down to Queens. Was that correct?
That is correct. My husband and my daughter's a teacher, and that was the closest place that she could find. So we went down there last Saturday before we got our vaccines, or 2 Saturdays ago, so she can get her second shot. My husband, the same thing, had to go far because I expected or hoped that in the office the local physicians would get vaccines sooner than we did. But listen, it took 4 months, but eventually we got them. So I'm happy to have them and be helping eradicate COVID. So.
Absolutely. That's great. That's perfect. And one last time, the procedure to make an appointment for your office. I just want to make sure that we touch on this one more time. So residents, they don't need to be a patient of yours?
Not at all. Nope.
And they can just call your office?
Just call the office, 914-245-4186. Talk to the young ladies that will answer the phone, or Laura and Anna. They will talk to you. They will ask you about your insurance. They will ask you, to bring your ID. They will give you an appointment. And I believe, like I said, tomorrow they will be offering both the Moderna and the J&J, but I expect to have the Moderna pretty much done today.
Okay.
And then we'll have J&J, I know this week and probably next week, another 200 allotments. So we're doing great.
Other than the one-shot factor from the J&J,
yes.
Do you have a preference?
I tell everybody, whatever you can get, just get it.
Got it. That's great advice. Anything that you'd like to add, Doc?
I think that's pretty much it. I'm just going to give everybody my website, too, if you want to go online and look at the website. It's drt@drtonline.org. So we have a whole bunch of information about services we provide, and we've been in the community. I've lived here for over 20 years. My daughter's a teacher in the community. We are just true Yorktown folks, and we love it here. So
excellent.
Happy to be helping.
Well, we appreciate your partnership and your leadership on this as we try, as she said, to eradicate COVID-19 within our community and hopefully enjoy a very relaxing yet normal summer is what our goal is.
That's it.
As a reminder for residents of Yorktown, you can continue to monitor yorktownny.org. Our community impact dashboard continues to be updated with any and all new information, new data. As a reminder, we do provide the breakdown by zip code as it's provided by our partners at the Westchester County Health Department. And again, in order to get onto our standby list, go right on that website and you can go onto the standby list, and you will receive a link as our pop-up clinics become more available. Until then, Yorktown, continue to wear that mask, continue to make those smart and responsible decisions, and if we have any other new information coming your way, we'll be sure to get it to you as soon as we can. Until then, stay safe, and we'll talk to you soon. Thank you.